So you can see that the triage center has been cleared, which means that all the patients have been attended to, and they are now in various departments, either still in theater or on the wards or in ICU, receiving specialist attention. So, it's important that people understand the concept of triage. So when there's a mass disaster like we experienced today, the first agency that appears on the site is the Lagos State Emergency Service, LASEMA. Their job is to with their heavy equipment, to cordon off the space and to create access for our pre-hospital management specialists who are LASAMBOS. So LASAMBOS will appear at the site of a mass casualty with our specialized ambulances. They're called medical intensive care ambulances. Inside those ambulances, they have all the equipment they require to manage very sick patients. So LASEMA will go to a site, clear it, mobilize access. They will break down if they're patients in a building or if they're in a train or in a bus. They will cut open the bus so that our ambulance specialists, paramedics can access the patients. They will set up the first triage. Triage means sorting out patients. So we need to sort out the patients at the site of the mass casualty. So the first triage is set up at the site. Now, in a mass casualty of this nature, you have patients with varying degrees and severity of injury. For example, if you have a broken hand, I don't need to transport you first to a hospital compared to somebody with a brain injury, a chest injury, or an abdominal injury who is bleeding. So triage means you attend to the most serious critically injured patients first, you stabilize them and you move them first. Then you start attending to people with less severe injuries that are not life-threatening. In a mass casualty like this, it is these paramedics that actually save lives because they are able to move patients in a prioritized fashion. So outside the accident, they will set up the first triage. It will be on the open ground, depending on where you are. They'll sort out the patients, they'll move the most sick patients first. Then they start to move the moderate patients, then they move the mild patients. That way, we're saving lives every minute. When you come to the center of excellence, which is LASUTH in this case, and we will always choose LASUTH first, because it is in LASUTH that again we will set up the second triage center. When you have over 50 injured patients, there is no emergency unit in the world that can accommodate large numbers of severely injured patients. So as you can see here, we have a massive triage center immediately outside the surgical emergency. It is specially prepared for this kind of situation where you have space, you can set up your tents and you lay all your patients down on mattresses, and now you have a second level of triage where specialists in the hospital come out and they now are able to identify those that need to be taken into theater immediately to save their lives. And then there's the moderate injuries and then there's the mild injuries. So in a place like this, the doctors and nurses will go through all the patients. They'll say, this one, theater, this one, theater, this one, ICU, this one, hold on, we're coming back. This one, go to X-ray. This one, put a POP on their arm. And if you were here this afternoon, you would have seen that happening in real time. As the patients who are critically ill were moved into theater, while those that could be attended over time, and within a period of 2 to 3 hours, patients started to move. At the same time, we will move moderate patients to our support general hospitals. So as I said, we move patients to the Accident and Emergency Center on Tollgate, we move patients to Bagada, we move patients to Lagos Island, we move patients to Orile Agege General Hospital. And there, they also have specialists there that were decongesting LASUTH because LASUTH has its own capacity. You can't exceed its capacity. You need to allow LASUTH to deal with those critical patients.